To the lighthouse of knowledge, we sail uncharted seas, guided only by the flickering light of inquiry. The study addresses a crucial gap in stable coronary artery disease management, defining the precise physiological onset of angina in relation to coronary revascularization. ORBITA-FIRE was a double-blind, randomized, placebo-controlled study including 65 patients with stable angina and single-vessel coronary artery disease. Participants underwent imaging-guided percutaneous coronary intervention, followed by incremental in-stent balloon inflation to assess angina onset at rest. Angina thresholds were evaluated against placebo inflation, documenting fractional flow reserve and resting full-cycle ratio at symptom onset. The primary outcome was the correlation of these thresholds with angina onset across varying exercise intensities.
Quick take. This study uniquely investigates angina onset in relation to personalized cardiac physiology at different activity levels.
Median fractional flow reserve at rest was significantly lower than clinical cut points, increasing under exercise conditions, p-value less than 0.001. Resting thresholds for fractional flow reserve and resting full-cycle ratio were measurably lower than standard guidelines, enhancing symptom reproducibility across tests. The authors conclude that lower individualized angina thresholds can refine patient selection and optimize symptomatic relief through personalizing percutaneous coronary intervention strategies.
Quick take. Personalized angina thresholds could lead to better targeted interventions in coronary artery disease.
Short quiz, clinical vignette. Question: a 64-year-old male with a history of hypertension presents with stable exertional angina. He undergoes a percutaneous coronary intervention with imaging guidance. His pre-procedure fractional flow reserve is 0.58. At rest, his fractional flow reserve at angina onset is recorded. What does a lower than usual threshold indicate in this scenario? Option 1. Higher probability of symptom reproducibility and relief post-procedure. Option 2. Decreased likelihood of successful revascularization. Option 3. Lower baseline ischemic burden. Option 4. Universal applicability across all patients.
The answer is option 1. The study found that lower fractional flow reserve thresholds correlate with increased symptom reproducibility and greater relief following percutaneous coronary intervention, supporting personalized physiological assessment.